Good morning to everyone. Thank you for spending time to be with us today. So, we promise to make this 17th primary care to be center of operational excellence here in Cagayan de Oro. We will offer varied services and laboratories for all our members to enjoy. So this is our 15th primary care clinic. MaxiCare would like to enable the living the best life via our state-of-the-art primary care clinic.
Here in Bacolod, we offer you state-of-the-art equipment, no LOE needed, and then we have the best ambience to give you your best healthcare experience.
As soon as you enter our clinic, you'll be greeted by our staff, our nurses, and our customer service representative. And then you just have to tap your card, put in your queue number, and you'll be queued to any available specialist here in the clinic. You can also have procedures here in our clinic like 2D echo, ultrasound, and laboratories.
Please come visit us at our new MaxiCare Primary Care Clinic here at Loop West, Mandalagan, Bacolod City.
MaxiCare members, welcome to another MaxiCare webinar entitled Happy Family Tip, Prevent Pediatric Infections, which of course is brought to you by MaxiCare so we can keep our kids happy and healthy. Now, before we start, let's share a few tips on how to fully enjoy today's webinar. First off, make sure your devices are fully charged just like you and you have access to stable internet connection. Now, if you get disconnected at any time, you can rejoin using the same link. If you're using a phone or a tablet, can we suggest that you put it on landscape mode? We also recommend that you close other apps on your device so you can be free from so many distractions. Now, we will be starting in just a few minutes, so take this time to prepare for an afternoon of learning. To all of our viewers on Facebook Live, hello and welcome. We're so happy you guys can join us. I won't keep you guys waiting any longer. Let's officially kick off our MaxiCare webinar. Welcome to a MaxiCare webinar entitled Happy Family Tip, Prevent Pediatric Infections. My name is Patricia Bermudez-Hizon, and I'm so happy to get to host and be with you this afternoon because also I'm a mom and I really need to know a lot of these great tips that we are about to tackle. We are tackling a really relevant and important topic today, so do share your thoughts and learnings of this event through your social media accounts using the hashtag Live Your Best Life. And please don't forget to tag MaxiCare using their social media handles on Facebook, where you are watching right now. For some of you, it's at MaxiCare Healthcare Corp. The official IG is at MaxiCare Healthcare. And please also subscribe to their health and wellness IG, where they give so many great tips. It's at MaxiCare Health and Wellness. Also, please subscribe to their YouTube channel too. MaxiCare Healthcare Corporation is the channel that you need to follow and subscribe to. For those of you who are watching our live stream, can we ask that you please share that share button right now? Can you do it right now? And also, apart from getting to share it with others, you can actually get to educate your friends, your loved ones, simply by posting this event on your pages. And we'd also like for you to hit that like button every time you hear something relevant to you. Can you guys test that? All those who are watching us on the live stream, press that like button maybe 3 times. Now, today we have our experts, Dr. Nicole Perreras and Dr. Salvador, who will share their knowledge and discuss common childhood infections, the power of prevention, and the importance of early intervention. Now, these are things that I, as a mother, would like to know more about. We'll learn about the signs and symptoms to watch out for, simple steps of keeping our kids from getting sick, and so much more. I know you all are excited, as I am, for this conversation. But for those who are inside this webinar, can I ask you to join me in this poll question activity before we get going? This is going to be quick, and all you have to do is to click on the answer that you mostly believe in or best suits you. Simple, right? Are you ready? Here we go. Here's our first poll question. When was your families, especially your kids, last checkup? Do you still remember? Was it just recently, like a week ago, or maybe even a month ago? Maybe this one is what I'm gonna click on, 2 to 6 months ago. Last year ba? Or you don't remember? Sometimes that is something that, all of us moms are so preoccupied with. But please go ahead and share with us what your answers are. And we're going to get to see in just a while what the poll question reveals about all of us. Wow, 67% says you just had your checkup recently, about a week ago or a month ago. That is great. And a lot of us also said last year. That's okay. Very, very honest of you guys. Let's see how you guys will fare in our second poll question. The second one asks, what is your primary concern regarding common childhood infections. There's only a single choice that you need to click on. Either you worry about recognizing the symptoms of different infections, or you're unsure when to ask medical attention for your child's illness, or you'd like to learn more about preventing common childhood infections. That's me. I'll check on that. Or others, you can actually specify on the chat. So I got my chat on and I get to see what your answers could be. So I'll give you guys a little bit of time. For me, I really would like to learn more about preventing common childhood infections. Prevention is really key, but that actually allows for us or requires for us to go to the doctor even more, right? So let's take a look at what the poll results show. And for this one, yes, majority of us would like to learn more about prevention, preventing common childhood infections. And also a lot of people are worried about recognizing the symptoms of different infections. As a mom, even if I have 3 kids, that's also my struggle. So thanks so much for sharing. Now we still have one more to go. Let's go to the third and final poll question. This one asks, which of the following common childhood infections are you most interested in learning about? And you can select all that apply. Are you here to learn more about ear infections, colds and flu, stomach flu, yung gastroenteritis, or the respiratory syncytial virus or RSV, or urinary tract infection, UTI, or others? You may specify it also on the chat. I'll be watching out for that. Oh, I remember when my daughter had an ear infection. I really didn't know what to do. So I'm so glad that we are here to learn together because that's really so uncomfortable. And of course, colds and flu, maski mainit, right? So let's check out what your answers are and what are the top questions or concerns that you have. A lot of people actually pantay siya for colds and flu and UTI. Thanks for sharing with us that you're really interested in that. And also, oh wow, we have also an even result for stomach flu and RSV or respiratory syncytial virus. Thanks so much for sharing all of those with us. Your insights are so valuable. So thanks for participating in the question. It really made us understand what you guys are looking for about the topics and the discussions that we will have today. So we're going to get the ball rolling, okay? It's time to meet our speaker. She is a pediatric infectious disease specialist at Makati Medical Center, Asian Hospital and Medical Center, and the Research Institute for Tropical Medicine. I am so happy I get to hear from her once again. Here is Dr. Nicole Perreras.
Hi, Miss Pat. So the last time we saw each other, I wasn't a mom yet, but now I am, and I'm also 10 pounds heavier. So the poster is fake na. That's not how I look anymore.
And I
So-
love that. I love that you shared that right away, Doc, because obviously it just levels up the importance of this topic and the relevance to you also being a mom. So thanks for sharing that with us. Excited. And by the way, you look great.
Thank you. Thank you. Okay,
Now,
so
Doc, before we actually begin on the conversation, I will be sharing for our viewers some important trivia. Like this one. It is trivia time, ladies and gentlemen. And the first one that I get to share with you is this. You know, in 2020, pneumonia was actually the leading cause of mortality among children aged 1 to 4 years old in the Philippines. The number of deaths caused by such disease amounted to 527. The other major causes of child mortality in the country were remaining diseases of the nervous system, diarrhea, and gastroenteritis of presumed infectious disease, as well as accidental drowning and submersion. And this was gathered from Statistica for PH. Now that is interesting. Pneumonia talaga no was the leading cause of mortality. I'm going to jump to our second trivia that we'd like to share with you. According to UNICEF, pneumonia, diarrhea, and malaria were responsible for approximately 30% of global deaths among children under the age of 5 in 2019. Imagine, I mean, people don't realize that diarrhea is up there with pneumonia and malaria. So this is great that we're having this conversation. I'll move on to our next trivia that we'd like to share with all of you. Now, according to UNICEF, Approximately 700,000 children a year died from pneumonia, and in many parts of the world, a child dies from pneumonia every minute. Shocking, shocking. Now we go to the next one. According to UNICEF, also in 2021, there were 247 million malaria cases globally that led to 619 deaths in total. And the final one, according to UNICEF, 96% of the children who die from tuberculosis never access treatment. 96%. Doc Nicole, it's really so imperative that we have this close coordination with our healthcare providers. And I'm glad that we're having this conversation because those are glaring stats. So I'd like to turn it over to you so you can touch up on a lot of those, Doc Nicole.
Thank you, Miss Pat. Okay, good afternoon, everyone. I know this is a bit of an unholy hour, so noon. So I'm sorry to interrupt your lunch, but I hope we have an active interaction or learning in the next few minutes. So I'd like to talk a little about common childhood infections and any updates that we might have. So if you're like me and you have a baby or a child, you'll notice since last year, a lot of my patients' parents are always saying, Dok, ganun ba talaga? Kakagaling lang. Ito na naman, may bago na naman, ubot sipon. Tapos pag gumaling na doon, hand, foot, mouth disease naman. After another week, yung kuya naman yung may sakit. And if you experienced something like this, you will notice that a lot of our children are getting sick with cough, colds, and fever. So next slide, please. So for the next few minutes, I'd like to talk about how to recognize the signs and symptoms of one of the most common diseases that you will see in your children or mga pamangkin, apo, and how to prevent these infections. Because when you recognize signs and symptoms, you'll be able to access your healthcare provider right away. And I know during the pandemic and even up to now, we're lucky that we have access to teleconsultations because that wasn't the case a few years ago. So now anytime that you need a healthcare provider, you have access to it. So it will help if you know what to watch out for in your children. And of course, we want to prevent these infections from happening in the first place. So I'll move on to respiratory infections because in the past 2 years, this is almost all that I've been seeing. It was just a ping pong between like mini outbreaks of flu, RSV, and lately I'm sure you've all heard about the outbreak of pertussis in Quezon City and later on in other parts of the Philippines. So I want to discuss a little about pertussis, then flu, RSV, and pneumonia. So some of these were already mentioned by Ms. Pat as an introduction to our discussion. So let's dive right into pertussis. So if you'll recall, 2 months ago on the news, next slide please, you'll see on the news the Quezon City, the vicinity of Quezon City said that they had a pertussis outbreak. But actually, just to situate this, no, kahit po a few years ago, bago pa po nung pandemic, we were already seeing little bits of or like pocket outbreaks of pertussis. And the reason for that is nakakaligtaan na po kasi yung booster shots of our older children. So most of the time, parents are like right on schedule for all the shots up to 1 to 2 years old. But what is forgotten is that protection wanes. So bumababa po talaga ang protection from vaccines. So it's the school-age children who became at risk for pertussis. So trickling down through the years, no, because when I was in training in PGH in 2014, we already had the pertussis outbreak then. So now we're here in 2024 and we're still having these problems. So if you'll move on to the next slide, you'll see that what quickly followed suit were other vicinities reporting pertussis, and actually some areas were even using a pertussis tracker. So this is not, unfortunately, if you know the background of this disease, it's not actually just now. So you'll notice that a lot of your barangays are trying to recruit your kids to go back and get their booster shots or to receive their combination vaccines on time because hindi po ito bago. So the question is, how do we even know what pertussis is, di ba? Kasi actually, it's a vaccine preventable infection. Hindi na yan dapat as common as it used to be. So next slide, please. So whooping cough or pertussis, just to go into the science of it, is caused by the bacteria called Bordetella pertussis. So it is very highly contagious and it's very common in those who are less than 1 year old. So why? Because they're the ones who don't have their own antibodies yet. So this is the time that you're augmenting yung protection na galing sa nanay through the placenta with their own shots. So parang sila talaga yung weakest, plus they have the weakest immune systems if you compare them to older children. So why is it highly contagious? Next slide, please. It's because it is caused by droplet spread. So meaning if an infected person coughs or sneezes, they send out infected respiratory droplets in the air. So from the time that you may have been exposed to somebody with pertussis, in about a week or so, maari na din po kayong mahawa. So pag sinabi ko po very infectious, I'd like to share the next slide po with you just to show it in numbers ha. So don't be intimidated by the numbers. What I highlighted there in pertussis, if you'll see, each case of pertussis can affect up to 5 to 17 other people. So if you look at the picture here on the right side of your screen, one infected person can infect 5 other people, 5 to 17 other people. And those 5 people, if they don't have protection from or they're not up to date with their shots, can infect another 5 to 17 people. So it's almost as infectious as measles. And that's why the government targets dapat 92 to 94% of the population should be up to date with their shots to protect against pertussis. Kasi very nakakahawa po siya. Isang tao lang yon pero ang pwede niyang mahawa, it's exponential. Each case can infect 5 to 17 other patients or children. So next slide, please. So what I wanted to show po dito sa picture na to or this illustration is that it's a long drawn out illness. It used to be called the 100-day cough. So you have a period where from the time you're exposed to the time you'll have your initial symptoms, which is about a week or two. And then the actual time when you have these paroxysms of whooping cough can last up to even 8 weeks. So what I wanted to emphasize here is matagal siya. Unlike yung common cold lang, usually by 7 to 10 days, magaling na tayo if we don't have any other comorbid infections. But pertussis was really called the 100-day cough before. So in the next slide, I wanted to show you classic pertussis is pag narinig mo yung cough, hindi mo talaga malilimutan yun. I wish I could share the sound bite with you, but I think earlier we weren't able to play it well. But meron talaga at the end of the cough, it's machine gun bursts of coughing. So in between the cough, well yung bata. Tapos biglang aatakihin ng ubo, halos mabilaukan na siya. The eyes are even popping from the severity of the cough. And at the end of that, may whoop. So medyo pangit ang acting ko, but if you Google it and you look up whooping cough, you will see this picture or similar to this child who is really struggling to bring in oxygen because of the coughing fits. So next slide. So in the early stages of the disease, usually nga po walang lagnat. Lalo na po yung very small babies, they often don't have fever or it's very low grade. What's prominent here is they have a runny or a stuffy nose and they may have beginning cough. But what I want to emphasize here, if yung mga anak nyo po ay 3 months and below, usually ang nangyayari are pauses in breathing. Bigla na lang makikita nyo hindi humihinga si baby, nangingitim or nagbo-blue. So unlike older children, ang prominent is cough. So it's just for you to be aware so you can contact your healthcare provider right away if you notice this, no, na parang may runny nose, and then how come yung baby biglang may pauses in breathing, tapos nagbo-blue. So this stage could last for up to 2 weeks, but then we move on into the second stage, which is the paroxysmal stage. So yun po yung dinidescribe, no, rapid, violent, uncontrolled fits of coughing. And I remember when I was a student, the phrase that really caught me is eyes bulging already kasi kakaubo ng ubo nung bata. Para talagang masuka-suka na siya. So actually at the end of these coughing fits, after the whoop, the inspiratory whoop, meaning parang Finally, nag-stop yung coughing and you can take in a breath, you'll hear the characteristic whoop. And then, biglang masusuka yung bata. So if you Google it and you play it on YouTube, you will really see. Once you hear a pertussis-like cough, you'll never forget it. So this stage could last up to 8 weeks before finally you go into recovery, which is when the cough gradually gets better. So next slide, please. So other points that I wanted to share with you is that after the coughing fits, the child may vomit or may feel very tired, especially since a lot of the coughing can happen at night. So they really are struggling to take in oxygen during these rapid fire coughing fits. So next slide, please. So this was actually I was supposed to play this for you, but we had to skip that slide. So what I wanted to share here is, di ba, parang pag sinabi, baby, low-grade fever, runny nose, and cough, that sounds like any other respiratory virus. Eh, baka naman classic, ano lang yan, sipon-sipon. How will we know it's pertussis? So this table is applicable to smaller babies. So what was very common with them is they didn't have fever, but they had cyanosis or the bluish discoloration of the face because they would suddenly have periods where they weren't breathing suddenly, and they would have the paroxysmal coughs. Yung tas may whoop sa dulo, tas biglang yung iba nagsusuka. So next slide, please. So let's move on to another respiratory infection that was very common actually last year. Like November, December, there were peaks of influenza. So influenza is common flu. So I'm sure a lot of us are familiar now with influenza because yearly we get our flu shots. So next slide, please. So flu is actually very important because you would think it's just the common flu, but actually, especially in younger children, they can even be hospitalized for complications like pneumonia or difficulty breathing. So we shouldn't dismiss this as just the ordinary flu. So it may range po yan. Pwedeng after a few days, the child is already well, but some can progress to the severe form of illness because of maybe they're asthmatic or they have underlying heart disease. So it's not just something common lang. So be aware lang as parents if your child has congenital heart disease or asthma. Baka yung flu, what is just a common flu for another child might cause complications in your children. So next slide, please. So what are the symptoms of flu? So I borrowed this from the American Academy of Pediatrics. So kaya yung fever dyan is in Fahrenheit. But a sudden fever, so fever is a temperature of 37.8 degrees Celsius and up. So the child might have chills and body shakes, headaches, and body aches or myalgia. So that is very prominent in flu, high fever, and body aches. So these children can also have sore throat or a dry hacking cough and also a runny nose. So the difference between this and pertussis is this does not have the machine gun bursts of coughing with the bluish discoloration of the face. Iba talaga yung pertussis, may whoop sa dulo. Next slide, please. So flu is most contagious during the first 3 days of the illness. So it can start, so somebody might be contagious even before their symptoms develop, so a day before, and up to 7 days after becoming sick. And I'll never forget the 7 days because when I got influenza last year during the peak of all these influenza cases, I had to stay away talaga for 7 days from my baby, even when I was already well and I had taken an antiviral. It's that contagious. No? So I didn't really want my baby at the time to get flu. So it spreads similarly to pertussis by tiny droplets that fly into the air and can land in the mouths or noses of people who are nearby. And in some instances, you can even get flu from touching a surface that has the flu virus on it, and then you touch your eyes and nose or mouth. So children are more likely to get the infection, about twice more likely than adults 65 and older. So actually, ang flu, complicated siya for the very young and the very old, or not naman very old, but 65 and up, parang extremes of ages. Okay, next slide, please. So you could have complications from flu like bacterial pneumonia, ear infection. So I'm sure some of your children have already had ear infections, and Miss Pat is right. Talagang very uncomfortable siya. You could have sinus infections from the prolonged nasal congestion and worsening of chronic medical conditions like asthma, diabetes, and heart disease. So it's more likely to happen in those who are very young, like less than 5 years old, those who are obese, and even those who are pregnant. So most of the time, flu will, your children will recover, but you of course have to keep in mind, pwede pa rin magka-komplikasyon from that. So next slide, please. So let's move on no, to RSV or respiratory syncytial virus. So to be honest, dati skip lang namin yan sa book or parang we just know it in theory, but because we didn't really have a way to test it, it was just something that we would assume was causing cough and colds in infants, in very small babies. But now there's more awareness of this RSV infection. So next slide, please. So RSV is most common in small children. It's the leading viral cause of lower respiratory tract infections in children worldwide. So globally, it causes 33 million episodes of illness. So if you think the 33 million children or 33 million cases per year, and it causes 3.2 million hospitalizations yearly globally. So amongst all those hospitalizations, the complications are usually in those less than 6 months of age. So actually sa amin sa med school, yan talagang lalabas. What is the most common cause of viral cough and colds in infants 6 months and below? And the answer was always going to be RSV. So next slide, please. So RSV, similar to the flu, can cause colds, cough, runny nose, sneezing, low-grade fever, and severe bronchiolitis. So bronchiolitis is like infection of the smaller airways. So usually flu, di ba, parang more of runny nose, cough, and unless complicated, hopefully will not progress to pneumonia. But here for RSV, in very small infants, ang nagiging problem is the hyper-responsiveness of the airway. So pwedeng may wheezing and low oxygen when you measure the oxygen saturation of the children. So next slide, please. So unfortunately, so what parang the colors started melding into each other, no, into sa graph na to. But what I wanted to show here in this slide, for children who presented with cough, a runny nose, and sore throat, there was really a peak of RSV during the year 2023 in the latter part of the year, mga July, August, September. But you'll also see if you read the small words below, no, it wasn't COVID na madami nung year na yon. COVID is the red line, and you'll see it was very low in comparison to flu and RSV. So I just wanted to show this, that the government was aware of this. We were doing active surveillance for these causes of cough and colds in our patients. So next slide, please. So the next slide will be numbers again, no? But if you look at the third row, the third bar, for those who are RSV positive, it was so nawala yung yung color, but actually a majority of the cases were in those less than 12 months of age. And if you look for flu naman, it was more common in those 1 to less than 5 years old. So my point here is that RSV and flu were we had peaks of those infections last year. So next slide, please. So here, this is a graph, a similar graph, but what I wanted to show here is that there was really a peak in RSV. That's what you'll see that reached number 50. So there was a point last year where a lot of the cases for severe acute respiratory infection, so malamang po na-admit yung mga batang ito, were secondary to RSV. So it's not just something theoretical for medical practitioners. Next slide, please. So how do you know when to take a baby with RSV to the hospital? Kasi you might think, cough, fever, colds, maybe kaya pa yan sa house. So when you recognize these symptoms, you contact your medical healthcare providers, like through telecon or text, or I don't know how you are able to communicate with your healthcare providers, but I'm sure a lot of us now have access to the 24-hour teleconsult services. So these are some of the signs, though, that a consult will not do and you have to bring the baby to the hospital is when there's discoloration na, cyanosis of the lips or mouth or fingernails. Hapong-hapo na yung baby, no? At saka kitang-kita mo na nag-cave in yung chest to bring in oxygen. And when the baby is breathing noisily or not taking in enough fluids, may signs of dehydration already. So next slide, please. So we'll go on, move into pediatric community-acquired pneumonia that's secondary to bacteria. So for this part of my discussion, I'd like to talk about Streptococcus pneumoniae and the walking pneumonia secondary to Mycoplasma pneumonia. So let's see the next slide. So pneumococcal disease is caused by Streptococcus pneumoniae. So it's just one of the many causes of pneumonia. But this is particularly of interest because there is a vaccine to help decrease the rate of severity or parang complications from it. And Ms. Pat mentioned middle ear infection. So it might surprise you that not only does it cause pneumonia, it can also cause ear infections. Now, to tie up to what we were discussing earlier in terms of trivia, kung nakikita niyo po itong pie graph na to, you'll see that worldwide, the data hasn't changed no, from 2017 up to now. Pneumonia is still one of the number one causes of infection in children. So, number one would be pneumonia, followed by diarrhea and neonatal sepsis. So, parang these are still some of the things we have to target to bring down the causes of infection in children. So next slide, please. So pneumonia secondary to Streptococcus pneumoniae and Mycoplasma pneumonia are what I want to discuss now because these are the more common or more familiar to us. No, I'm sure a few weeks ago we heard about the walking pneumonia secondary to Mycoplasma pneumoniae. So there are certain children or patients who are more likely to contract pneumonia. So yun yung mga under 5s. That's why you'll notice your children, if you've been going to your healthcare provider regularly, they have 4 shots of their pneumonia vaccine before they're 2 years old. So lalo na yung mga may heart disease, like congenital heart disease, yung mga may butas sa puso, those who have asthma, those are the ones who are more prone to bacterial pneumonia. So next slide, please. So for pneumonia, there's a classic triad. Pag sinabing triad, itong tatlong to will very accurately predict that the patient might have pneumonia. So yan yung mga batang may lagnat, ubo, and increased work of breathing. So similar to RSV, yun pa rin yun yung parang umaalon yung tiyan or what we call retractions or maybe even alar flaring or the nose is parang flaring out to help bring in oxygen. The breathing rate might be faster. So these are the signs and symptoms that if you see in your baby, you have to contact your doctor immediately because your child may have pneumonia. Next slide, please. So this part was taken from the clinical guidelines that we use for treating or recognizing pneumonia. So this is something you can do as parents at home. Pag sinabing fast breathing, it depends on how old your child is. So please take note of this. So if you have a baby who's 3 months to 12 months old, dapat yung breathing nila in 1 full minute, dapat 50 breaths and below. So if you have a 12-month-old who's breathing 60 breaths per minute, maano yun, mabilis na po yun. So as they get older, no, they breathe less per minute. So you have to know these cutoffs so that when you call your healthcare provider, it will help. When you say, Doc, parang 3 araw nang inuubo yung anak ko tapos 2 years old na po siya ngayon. So parang yung hinga niya parang 50 breaths na per minute. So that gives the doctor a clue. No, even if they might not see you, even if you're doing a teleconsult, alam nila ay mabilis na yon. So you can also check your oxygen saturations. Diba nung COVID, we had these like kits where you would be able to check the oxygen status of your children using a pulse oximeter. And if you also have grunting, so these are signs that the child is having difficulty breathing and might have pneumonia. So next slide, please. So not all children will need to be admitted into the hospital with pneumonia, but who are those who are most likely going to need admission? So yan yung mga less than 6 months old. Those are the babies who have to be monitored very closely. Those who look very ill, those who might be immunocompromised, so maybe children with cancer, children who have HIV, those who have low oxygen saturation when you measure it using your pulse oximeter, or yung mga nanlalamig na matamlay, hindi na umiinom, hindi na nagdedede, then those are the patients who most likely will need to be admitted in the hospital. So next slide, please. So I'd like to talk a little about the walking pneumonia. Okay, so a few months ago, suddenly there were these news blips no, na parang there's an outbreak of pneumonia in children in China, and everybody was worried, is this going to be another COVID? But it turns out during surveillance, it was secondary to Mycoplasma pneumoniae, which is not a new bacteria. So this is really one of the causes of childhood pneumonia, and in fact, even pneumonia in adults. So next slide, please. So symptoms occur 1 to 4 weeks after being exposed to another child or adult with Mycoplasma pneumonia. Parang tongue twister. So other symptoms would be a sore throat, fever, and headache. And what's different in Mycoplasma pneumonia is that the cough gradually worsens and lasts for a long time. Now, children younger than 5 years old can have the usual runny nose, sore throat, and wheezing. But what's prominent talaga in the walking pneumonia is that the cough is slowly worsening, but you don't have the whoop that pertussis has. So actually, a lot of them don't have fever. They're running around, they're walking around with cough, but they don't look as very ill. Pero pag in X-ray sila, the X-ray looks worse than what the child actually presents. So that's one of the clues na that's a walking pneumonia. So next slide, please. So this is kind of what I already discussed. No? So what differentiates walking pneumonia from other symptoms? There's that gradual onset in comparison to those with like, for example, strep pneumonia, na mabilisan, parang suddenly the child was well yesterday, but suddenly now high fever, bad cough, difficulty breathing. So next slide, please. So what diagnostic tests will your doctor require or ask from you if it's not just a mild cough or cold? So some of us might then have an X-ray, some might have an ultrasound if on the X-ray mukhang may fluid dun sa X-ray natin, and we might have some blood work like a CBC or a procalcitonin. So procalcitonin has recently been recommended for severe pneumonia. So it's not necessary in those who don't have severe pneumonia, because actually you don't even need diagnostics if your child has fever, cough, and difficulty breathing. Usually your healthcare provider will start treatment na for pneumonia. But if your child is getting worse, these are some of the labs that you may need to have your child undergo. So next slide, please. So this brings me to the latter part na, no? So these are the common respiratory infections we've been seeing. Pertussis, you will not forget because of the classic whoop, and you have to check the vaccination status of your child kasi baka po nakaligtaan na yung mga boosters and your child might have waning protection. Flu can present also with fever and cough, but what's prominent is the body aches. No? And RSV is more common in really small babies. Pneumonia, strep pneumonia, and walking pneumonia from secondary to Mycoplasma pneumoniae naman. Strep pneumonia will have classic signs on X-ray and usually sudden onset ito versus walking pneumonia where the cough was kind of prolonged. Okay, so how else can you differentiate these from one another? Next slide. Not all of them have vaccines to prevent them. So you do have a pertussis vaccine. If you could kindly click on the slide po. So yes, you would have a vaccine for pertussis. Yes, you'd have a vaccine for flu. So usually that's yearly. RSV, we don't have a vaccine straight for children, but what is licensed now is one shot for pregnant women. It's the pregnant woman who will pass on the protection to her unborn child. So paglabas ng bata, meron na siyang preformed antibodies from the mom, but that hasn't been brought into the country yet. Your strep pneumonia or your pneumococcal vaccine has been available for a very long time already, but walking pneumonia or pneumonia due to mycoplasma, we do not have a vaccine for that. But 3 out of 5 pwede na, di ba? So that's a lot of conferred protection for our children against cough and colds. So next slide, please. So I already discussed this. So next slide, please. So treatment. Pertussis and walking pneumonia, if you'll notice, they have the same antibiotics that will be used. Those are the macrolides like azithromycin and clarithromycin. Your influenza will be treated by antivirals using oseltamivir. So actually, that's the only, at present, no, that's the only antiviral that we have, and that's really specific just for flu. RSV doesn't have any locally available antiviral. In other countries, that is available. And for your pneumococcal pneumonia, you have the following antibiotics. I'm sure some of them are familiar to you, like amoxicillin and coamoxiclav. So next slide, please. So let's go in a little bit into dengue fever naman. So this is common all year round in the Philippines. So next slide. So some key facts, it can start as a flu-like illness, and it's most common in tropical countries like the Philippines because we're the ones that carry the vector. Or the vector meaning the mosquito is the one that bites us and transmits the infection to us or to our children. So there isn't any specific treatment for dengue, but early detection and access to healthcare lowers the fatality rates to less than 1%. So it's very important that you contact your doctor right away when you suspect your child might have dengue. Next slide, please. So 40% of children worldwide are at risk for dengue. 390 million children actually do get the infection. So that's a big number. So we really want to lessen that because it causes a lot of healthcare parang cost, no? Pag kailangan i-admit yung mga anak natin. Next slide, please. So I just wanted to show you that this is really more of a tropical, subtropical infection. Yun po yung mga naka-pink and red. So if you'll see the Philippines, talagang red na red. Madaming dengue sa atin as well as in South America. Next slide, please. So I just wanted to emphasize in this slide, no, ano yung warning signs na sinasabi namin that will ask or will warrant admission in your children. So somebody with dengue should live in a dengue endemic area like us with fever and 2 of the following, no? Parang may nausea, vomiting, might have a rash, body aches and pains. The white count when you take the CBC is low, plus these warning signs. Warning signs are persistent vomiting. So that means kasi you cannot hydrate orally. You might have abdominal pain or tenderness. Baka medyo hilo-hilo or sleepy-sleepy, lethargic yung bata, which is an emergency and you need to really admit that child. Or your platelet count is rapidly decreasing. So these are the children who will need to be admitted for dengue. Next slide, please. So dengue usually lasts about 7 to 10 days. And actually what I wanted to emphasize here, ang critical phase ng dengue is not when the fever is gone. Actually, dun palang paumpisa ang critical period. So the 2 days when the child has no fever, that's actually when most of the complications might set in. So in the first few days of dengue, you'll have high fever, possible dehydration, headache, before you go into the critical phase where there's no fever, and after which you'll have recovery. So next slide. So some of the tests that will be ordered will depend on what stage na yung kung saan na yung anak nyo. Kung nasa febrile stage, we will be monitoring using CBC and dengue NS1, which I'm sure some of you have already heard of. But starting on the 5th day onwards, hindi na po useful ang NS1, dengue IgM and IgG na ang hinahanap namin. So I just wanted to emphasize here that depending on the day of illness, iba din ang posibleng ma-order ng mga doktor natin. Next slide. So just to show here, NS1 is for acute infections the first 3 days, and the dengue antibodies will be from day 5 onwards. Next slide, please. So some high-risk patients, so if you have these or you have these conditions in your children, these are the ones who need closer monitoring, whether via teleconsult or actual clinic visits. No? So those who are obese, small children, those with diabetes, and those who have heart disease. So yan yung mga red flags in children, no, for complicated dengue. So when you talk about complications of dengue, next slide please, those might be liver failure because the dengue virus likes attaching to the brain and the liver. You could have alterations in consciousness, yung iba nga nagkakaroon ng confused state, nagsiseizure or bleeding in very severe cases. Next slide. You could also have bleeding. No? So usually the most common site will be your gastrointestinal tract. And because of may sakit na yung bata, no, you could have, these children might be at risk for sepsis or bacteremia, meaning may bacteria na nasa dugo ng bata. Next slide, please. So let's move on to another common infection these days. That would be your stomach flu, which Ms. Pat mentioned earlier, or yung acute gastroenteritis. So I will be quoting in the next few slides the guideline from the Philippine Pediatric Society and the Society of our Gastroenterologists. Next slide, please. So when we talk about gastroenteritis, that means your child has loose, watery, non-bloody stools that occur 3 or more times in a 24-hour period, and it occurs less than 14 days. So just to situate these recommendations, this is for home care. Yung mga kaya pa ng teleconsult. Kaya na-mention dyan, non-bloody. Because bloody stools are an emergency and you have to bring the child right away to the hospital. So if your child has loose watery stools 3 or 4 times, but is drinking well, alert, playing naman, kahit medyo matamlay, and urinating every 6 to 8 hours, then you can take care of them at home using the following guidelines, which I will show you in the next slide. So you can continue feeding them with a diet appropriate for their age and continue exclusive breastfeeding if your child is 6 months and below. But if you're already starting your complementary food 6 months and up, then you may continue that diet for the age of the child. You should give fluids as tolerated, meaning kahit slow sips lang, basta tuloy-tuloy pong may natotolerate. Kasi hindi naman pwedeng isahang laklak, baka magsuka yung bata. So please avoid giving carbonated or very sweet drinks during a period of diarrhea because that will not really accurately hydrate your child. So you should be giving ORS or oral rehydration solution. So this is not a commercial, but some of the brands available would be your Vivalite, Pedialyte, Glucolite, Vivity. So yan yung mga available in the market. I'm not endorsing any particular brand. Next slide, please. So how do you give your oral rehydration solution? So what I will highlight here is that it depends on what you're using. If you're using a glucolite sachet, then you dissolve it in 100 ml of cool boiled water. But if you're using Hydrite, then it's 1 sachet in 200 ml of water. But you already have those that are ready to drink, like your Pedialyte and your glucolite. So next slide, please. You should also give zinc because it's supposed to prevent from further or future gastroenteritis bouts. So I'm not asking you to memorize the dose, but just to be aware that your doctor will give you zinc as part of the treatment for gastroenteritis. Next slide. And you will also be receiving probiotics. So sorry na medyo naurong yung slide, but it is also part of the treatment of gastroenteritis to give a supportive treatment like probiotics and to prevent dehydration, racecadotril. So this is usually given during the first 3 days of an infection with watery diarrhea. So next slide, please. Now it's important that follow-up is done if symptoms persist beyond 3 days or if the hydration of status of your child is worsening. Or suka ng suka, hindi nakaka-take in ng medicine or ng milk or water. So in that case, you might have to call your doctor and say, I think, doc, we have to see you face-to-face, or you might need to go to the hospital. But if your child is drinking well, with mild dehydration pa lang, then maybe you can manage at home with the guidance of your teleconsult teleconsultations. Next slide. So how do we prevent gastroenteritis? With the following, no? Drink clean and safe water, wash raw foods and cook them well, store them properly, do diligent hand washing while preparing food. Using hand sanitizers is also, these are not recommended if visibly dirty na yung hands nyo. Pag ganun, you really have to wash with water. But if they're visibly clean, then alcohol or wipes will do. So you should also flush with the lid down to prevent like any splashes and contamination. And you should really make sure that you dispose of diapers properly and do your proper hand hygiene. So we're moving into the last part of my discussion, which is on animal bites. So during COVID, a lot of people decided to get pets because we were in lockdown, and there were a lot of animal bite cases that were being seen in emergency rooms worldwide, not just in the Philippines. So worldwide ito. So an animal bite can be, in the Philippines, is most commonly from the domestic dog, and a portion will be from cats. So what I wanted to emphasize, if nakalmot or nakagat yung anak nyo ng aso or pusa, the most important, more than any vaccine, will be wound care. Because right after the bite, you have to make sure, di ba, ang rabies virus natatransmit sa saliva ng infected animal. You want to make sure you wash that bite or scratch immediately, flush it with soap and water for 10 minutes. Running water talaga yan. And if soap is not available, then at least running water. So hindi pwede yung wipe lang. 10 minutes of running water to make sure the saliva is washed out. Next slide. So of course, if you have an animal bite, you have to after washing apply alcohol or iodine. And call your physician for your post-exposure prophylaxis rabies vaccines and even immunoglobulins. So in the next slide, what I wanted to emphasize would be, what do you ask, no? Pag pumunta ka pag tumawag ka, no, nag-teleconsult ka, Doc, nakagat po yung anak ko ng aso. So tatanungin sa inyo usually, pet nyo ba yan? Or is it a stray dog? Do you know the vaccination status of that animal? And will you be able to keep an eye on that dog for 14 days? Kasi a rabid dog or cat will show symptoms within 10 to 14 days. So if that biting animal is alive 14 days from the bite, then that means he's not rabid and could not pass on rabies to your child. So you should also ask, has your child received rabies vaccine before? So yan yung mga tatanungin sa atin po. So next slide. So there are many exposures that we might have to animals. So ang importante is yung category. So that's actually what you'll see in the final diagnosis in your discharge papers. So category 1 is usually just casual contact with an animal, meaning walang break sa skin, there's no scratch or bite involved. Category 2, which is in the next slide, would be any bite or scratch without any spontaneous bleeding. So, yan ang keyword dyan, no? Spontaneous bleeding. Kasi pwede kang makalmot ng cat, but there's no active bleeding. So, it's just like a superficial scratch. But if that scratch occurred in the head and neck because of the number of nerve endings in that area, nababump up yan automatically sa category 3. So, why am I talking about categories? Because the category will dictate the management. So, a category 3 bite is what you should take note of. These are puncture wounds, lacerations, deep scratches with spontaneous bleeding, or even licks on broken skin, basta nasa head and neck. So, and interestingly, even direct contact with bats is a category 3 exposure. So not only will your child receive the rabies vaccine, which kicks in after 10 to 14 days, but he will also need immediate protection from virus with your immunoglobulin. So next slide. These are examples of category 3 bites. And if you'll notice, ang rabies or animal bites sa Philippines, usually 15 years old and below yung mga pasyente namin, because children are not able to assess the risk. Pag may nakita silang cute na animal, they zoom in or want to kiss in the face or hug the animal. So usually they're the ones who come in with category 3 bites. So as parents, you have to teach them how to approach an animal. Hindi pwedeng makita, hug agad, or zoom in. It might be perceived as a threat by that animal. So next slide, please. So post-exposure prophylaxis against rabies or PEP includes your immediate wound washing, passive protection against rabies, meaning pre-formed na yung antibodies, immunoglobulin na yung ibibigay, plus your rabies vaccine. Next slide, please. So I already talked about wound washing, but for post-exposure prophylaxis, meaning you want to cancel out or protect immediately at the bite site, you will need rabies vaccine. So depending on the regimen your animal bite clinic or the emergency room is using, could I have a few clicks po so that the dose will come out? Ay, so nawala yung graphic. But anyway, what's important here is that usually you will have a day 0, a day 3, and a day 7 dose. And depending on the clinic, sometimes merong pahabol between days 14 and 28. So you could have 4 to 5 shots into the muscle. So next slide, please. So yung immunoglobulin, yan yung pinaka-kinatatakutan natin because this is the one that's painful to inject because you have to inject it or infiltrate into the wound. So can you imagine if yung kalmot is nasa eyelid? You have to infiltrate nearby. So siguro not naman sa eyelid, no? Masyadong manipis yung skin dyan, but here, near the temple. So if it's a scratch na cut yung lip, usually they will infiltrate around that area kung saan nakagat. So hindi na, before ang ginagawa is we compute it based on the weight of the patient. But now, because we just want to infiltrate kung saan talaga yung bite, usually konti lang yun. Kung ano lang nung kaya nung area. For example, the face or the finger, usually mga 1 ml, 2 ml will be more than enough. Pero that's still very painful and traumatic for the child. Next slide. Sorry. Ayan, okay. So sorry for that typo error. So a 5-dose regimen will be distributed between day 0 to 28, but a 4-dose regimen will have shots on day 0, 3, and 7, followed by, sorry, another click please, 1 shot between days 14 to 20. Depende po sa ER or clinic that you are going to. In other countries, they use 2-1-1, meaning may 2 shots on the first day of consult. On the 7th day, they have 1 shot and 1 shot on the 21st day, post-bite. So next slide, please. So these are the different brands that we have in the Philippines. So merong Verorab, may Abayrab, Spida, Vaxirab. These are all good brands and are used by many animal bite centers locally. Next slide. So antibiotics may be needed for all frankly infected bite wounds or if you have a cat bite. So automatic yun. Kung category 3, meaning may spontaneous bleeding, and it's from a cat, automatically you will get an antibiotic. So usually that would be coamoxiclav or cefuroxime. Next slide, please. So don't forget that when you, in the management of animal bites, you have to observe the biting animal because if that animal is still alive 14 days from the bite, that means he or she is not rabid and cannot pass on any rabies virus. So during that observation period, lalo na kung pet yan, you just put them in a secluded area and still care for them, give them food and water. But once they show signs of being sick, then call your vet right away. And for you, call your pediatrician or do your teleconsult right away. Next slide, please. So I discussed so many things today, no? So we started off with what was common, no? Yung mga ubot sipon, whether it was viral or bacterial, and then we moved on to diarrhea, and lastly, animal bite. So those were and dengue. So these were very common in the past couple of months. So my last message would probably be access your healthcare right away, lalo na if you have access to teleconsults. That's very fortunate because you will receive advice on how to monitor your child, first aid and all that. And secondly, when we talk about prevention, please don't forget that vaccines are across the lifespan. Hindi lang siya pang bata, hindi lang siya pang baby. So you please check in with your healthcare providers. You might have a teen that's lacking a tetanus or a pertussis shot, or you might have an elderly person in your household who hasn't received the flu shot in the past couple of years. So please don't forget, shots are for everyone. They're not just for babies. So that's my last slide. thank you for listening. It was quite long, but I hope you learned something and I was able to share what I know with you. Thank you very much.
Well, thanks so much, Doc Nicole. I think as a parent, no, it didn't feel like long at all. I was writing down so many notes uh, because it's really important. And sometimes a lot of us don't really put a lot of focus or emphasis on prevention and even knowing what to do and how to respond. But that was so interesting. And pertussis, influenza. I learned so much about RSV, pneumonia,
Okay.
of course, dengue, di ba tuloy-tuloy yung information campaign on dengue. But I think what stood out to me the most are the common things, right? Like diarrhea. We tend to just overlook these types of things, and it can get quite scary. And even animal bites. So we do have a lot of animals at home. Talagang natamaan ako, but I picked up so many great tips, Doc. Thank you so much. And of course,
Sorry,
I'm sure,
Miss. Can I
yeah,
do
go ahead.
one last one? I forgot to mention for rabies, for animal bites, you can get actually shots to pre-exposure shots. So that means even if you have a bleeding wound, you will not need immunoglobulin anymore. So I think that's something that I want to emphasize kasi yan, yung immunoglobulin is actually very costly and very traumatic to the baby because you have to go into the wound. So if you can do pre-exposure shots, please do that. Sorry, I had to plug that in lang.
Oh no, go ahead, plug away. That's so important for all of us who are looking to, of course, have children and animals mix in one household. But even if they're not in your household, we are constantly exposed to animals around us. So thank you so much for adding that information. But of course, we will have our Q&A discussion, and we'll be bringing in someone also who will join in the conversation, who's, I'm sure, who has a list of questions that she'd like to ask, and also impart her knowledge on this topic and how to live a better life, live our best life, especially get our children to also live their best lives. So we will proceed with our Q&A as we meet this webinar's moderator, who is also a pediatric consultant at Makati Medical Center. I'm happy to have with us here Dr. Ella Salvador. Hi, Doc Ella.
Hello, Pat. So, thanks for having me this afternoon. So, good afternoon to all our viewers, those who have stayed throughout the presentation, and happy Friday, and hope you're enjoying your lunch. And also thank you to Dr. Nicole for this very informative presentation, because even though my kids are no longer in the pediatric age group, they're both bigger than I am. I think that the information that we've heard today is still relevant, and it's still relevant to me and also still relevant to my practice. So let's get the ball rolling with our first question. Our first question would be, can we have several vaccines in one clinic visit?
Yes, so definitely you can. I remember during the pandemic, that was one way to keep our children up to date, no? So parang less visits, but in each visit, multiple shots. So what's common is you'll have one combination vaccine, like a 6-in-1 shot, another pneumococcal vaccine shot, tapos isang oral. So that is totally acceptable. Those are in the guidelines and actually should really be practiced, no? Parang you maximize your clinic visit, except that I understand some of them are quite costly. So maybe that's why some parents or some pediatricians will offer to space it out na lang. So usually isang injection, isang oral. So that's also acceptable
Okay,
and
so
safe.
yeah, I think that's one of the more common questions. Is it safe to have
Yes,
multiple
safe.
vaccines in a visit? Kasi sometimes I see na pwedeng four in a visit, four shots, like one on each limb.
Actually,
So
you can if it's like
yeah.
if it's there's an urgent need for protection, then that can be that's safe.
Okay. Okay. Thanks. So our let's move on to our next question. So in this recently our hot weather, do we expect like an increase in the incidence of these infections during our presently very hot weather?
We might, because like for example, a gastroenteritis, you might, or some people might forget, no, that it's hotter than usual. We leave out food for longer than what's safe. So you might have early spoilage, or maybe it's hot weather. People tend to be swimming more often, no. So you might have some children who are actually recovering from a cough and cold, and they're all together. So, this is summer, di ba? Usually, yung mga common sore eyes, chicken pox, kasi nga nagkukumpul-kumpulan. Or for me, what I noticed, no, parang gastroenteritis is getting common because probably of food preparation problems.
Okay, and then if ever, what can our viewers do to prevent all of these infections during this hot weather?
So I guess one is to have a good working relationship with your healthcare provider. And I know I mentioned this many times, but the teleconsult is really so valuable because I'm sure if your parent or an auntie or an uncle, like all of us here, though, even diba, Doc Ella, we don't want them in the ER. If you
Yes.
only Doc Ella and I were co-residents and we were going on duty in the ER, and we would always think, naku, baka dito pa sila mahawa kasi if it's mild enough, you may not need to be in the ER. We don't want to discourage you from coming if talagang kailangan ng medical attention ng mga bata. But if you have another way, like if you can call your doctor, schedule a teleconsult, why bring them to the ER? But of course, kung kailangan, please pumunta kayo sa ER. Hindi namin sinasabi, huwag kayong pumunta. But if you have access to a doctor in another way and your child can be cared for at home, why not? Diba? Why not?
Yes, that's very true. And then there's a question here about pertussis. So if a patient, a baby, or even an adult has pertussis, are they contagious, and how long will they be contagious?
So they are contagious for about 5 to 6 days pa, no, into the illness,
Mm.
especially for pertussis, ha. The first part of the illness where they have a runny nose, that's when they're most contagious actually. So it's really very hard to control. That's why I mentioned earlier, one case, magsasanga-sanga yan, no? Ako will infect 5 to 10 other, 17 other patients. They will infect their own 5 to 17 other patients. So that's what causes these outbreaks. So nakakahawa po talaga yan. So that's why the earlier you receive the antibiotic, the less likely you will need admission. Plus, you will shorten the symptoms. So hopefully, because you're isolating from your other family members, you won't be passing on the infection to them. And of course, if you are up to date with your shots, you will be less likely to have the complications of pertussis.
Okay. Okay. So we'll have our last two questions. I think we have time for last two questions, and these pertain to dengue actually. So the first question would be, when you have dengue, are there any medications that we should be avoiding?
Avoiding. So maybe medicines that could alter platelet status or could induce bleeding. So I know it's the practice when we have dengue, we don't usually give ibuprofen because it can cause tummy aches and gastritis and also alters a little bit of the platelet function. Um, we do give omeprazole to parang prevent these. Di ba usually mga dengue patients wala masyadong appetite.
Yes.
So they don't want to take in food. Yun lang naman that I can think of for now. Parang mga dose na that can induce bleeding, like aspirin,
Yes.
yung mga,
Mm.
maybe just tell your doctor if your child is on that because extra precaution na.
Okay, okay. So we'll go to our last question for this afternoon. Somebody asked, "Can I get dengue again?" And
Yes.
if so, how can I prevent reinfection? Yes, because there are four.
Yes, so sadly, you can get 4 infections in your lifetime, but the first is usually very, very mild. So most of the time, hindi nga yan nadadiagnose. Magugulat ka na lang sa second dengue pag draw ng blood for the antibodies. If it's early on in the illness, no, not 5 to 7 days onwards, positive na sa IgG. So parang COVID, di ba? IgG yung old infection or from the vaccine. So one way, that's like how you'll know na, ay, nagka-dengue na pala ulit. So this might be the second or third. But by that time, usually yung fourth kasi may cross protection na. So usually ang prominent lang are 2 or 3 infections of dengue. But long story short, you can get dengue 4 times because there are 4 types.
Okay, so how can I prevent reinfection? Well, I guess, clean environment would be one of them.
Yeah, so parang avoid stagnant water kasi paano ba tayo nahawal ng dengue, nakuha yung dengue? Kagat ng lamok, yung mga day biters. So where do these day biters stay? Stagnant waters, yung mga naka-star na tubig. So if you have like ponds or vases, so make sure na these are cleaned out regularly kasi dyan mangingitlog yung mosquito eh.
Yeah.
And if you look it up on the DOH website and even WHO, they'll show you how to prevent, no? Parang if you're going out in the daytime, dress your child sensibly na naka-cover yung legs. Siyempre, hindi ko masabing long sleeves, mapiprito na tayong lahat. But in essence, cover up. And if your child is old enough, then put on a mosquito repellent.
Okay, so thank you very much, Dr. Nicole, for your inputs and all the questions. That's all the time we have for this afternoon. Miss Pat?
You both were having such a rich and informative conversation. I really wanted to jump in with my own questions, but I will take that advice of Doc Nicole. I really should get on that teleconsult. It's really important to have these regular conversations with experts such as yourselves, diba? And I think we all should take advantage of that ability to be able to converse with our doctors, especially with me. I have my almost 20-year-old son, not in pediatric anymore, a 17-year-old son, and my
Same.
4-year-old girl. And it's the 4-year-old girl who seems to get all the scratches and all these from our animals and everything else. But I am so glad I got to be part of that conversation and I got to hear from both of you. But before I let both of you go, for our attendees here, they would like to know more about your keys to living your best life. And if possible, can I start with Doc Nicole on that one?
Okay, so how to live my best life one? I guess this comes with age. Choose your battles. Accept what you cannot change. If alam mong wala nang wag, wag patulan lahat, wag patola. Avoid crowds. Please avoid crowds because that's where your cough and colds, you're gonna pick those up lalo na if you have very small children. And keep up to date on your shots. So don't forget po, no, across the lifespan, you have to check if you're up to date with your immunizations. So that's for me.
Bakit ako sobrang natamaan dun sa first one?
Ang hirap, no? Choose your battles. Okay.
But that applies also kasi minsan susugod na kagad tayo sa hospital. We'll be like overwhelmed with a simple cough, for example. Kailangan then we know how to address these battles that we're facing. But thanks, Doc. Natamaan ako. Now, I'd like to hear from Doc Ella. What are your key takeaways? And of course, what you'd like to share on how we can all live our best life.
Okay, so for me, an ounce of prevention is always worth a pound of cure. So make sure that you have your regular checkups, whether it be you are your baby or even yourself, us as adults. And always, again, like what Dr. Nicole said, vaccinations, update your vaccinations because they're not only for babies, they're only all our lifespan. The next would be that when symptoms occur, consult your doctor. Okay, because the earlier you get your checkup, and the earlier that you will have treatment. And don't forget, you can always call your trusted partner in healthcare by calling your MaxiCare primary clinics, and they can give you the proper advice on what to do.
Well, thanks. And that just reminds me, Doc Ella, that MaxiCare members are privileged talaga to have MaxiCare's 24/7 teleconsult service. And of course, the wonderful MaxiCare primary care clinics, which are all over the punchy now. So thanks so much for these wonderful keys to living your best life, and of course, spending this afternoon with us, Doc Ella and Dr. Cole.
Thank you as
Thank
well.
you.
Thank you for having me.
Thank you. Now, as we reach the end of this event, we'd like to ask a few moments from you to share some questions and answers, by the way, related to our webinar. And I'd like for all of you to just click on the answer that best suits you. Now, this poll question, I would like for you to actually scale 1 to 5, 5 being of the highest importance, on how important is it for you to live your best life by focusing more on your wellness. Right. Like they were talking about an ounce of prevention. They were talking about really understanding what symptoms are and everything. So we really have to focus on our wellness. 5 being the highest importance. Let's see what is the answer of our attendees here. And of course, just about everyone, over 90% of the attendees here feel like, yes, number 5 being of highest importance to them. It's really important for them to live their best life by focusing more on their wellness. I 100% agree with all of you. Let's proceed now to our second poll question. The second one asks if you were able to join us in our previous events, and we, of course, at MaxiCare, continue to provide information through these types of activities. I'd like to ask you if you found this session informative and useful regarding how you can take better care of your health and your children's health. Yes? No? I think I know what your answer is, especially those of you who have stuck with us on our live stream and here in this room. 100% yes. Thank you so much for sharing that with us. Of course, it's really important, but we wanted to make sure that you can actually share with us your feedback through this. Now, this is our final poll question. On a scale of 1 to 5, 5 being the highest, can you rate how today's webinar event has helped you further improve your health and wellness? Diba? Information is key. Sabi nga nila, knowing is already half the battle. You remember that cartoon, but it's true. But of course, this is all about you. Let's see what your feedback is. 90% of you agreed that this webinar has really helped you further improve your health and wellness because of all that added information, the great reminders, and of course, we're all also reminded of what MaxiCare can bring for all of you. Now, if you enjoyed this experience, please do share it on your social media using the hashtag Live Your Best Life. And you can also tag MaxiCare on Facebook at MaxiCare Healthcare Corp and on IG at MaxiCare Healthcare. Also, they have MaxiCare Health and Wellness on IG. And of course, you can do this when you share about your wonderful takeaways for this event. Remind your family and friends what you've learned about prevention, teleconsult, and all the different symptoms that you have to watch out for. But please also don't forget to subscribe to the YouTube channel of MaxiCare, and that is MaxiCare Healthcare Corporation on YouTube. Now, if you want to learn more about MaxiCare's products, and there are many that will suit your needs and the stage of your life that you're in, please do visit www.shop.maxicare.com.ph, and you can also send a message through FB Messenger. Now, if you have questions about MaxiCare's webinar, you may even send an email to maxicare@maxicare.com.ph. Perhaps we'll see you at the next ones. Thanks so much for being with us today. This ends our event. My name is Patricia Bermudez-Hizon. We hope that you enjoyed it and you were able to take away meaningful information. Thanks again. Have a great day. And we know that with MaxiCare, you can live your best life. Bye, everyone.